So this is the part of the procedure that is the actual restorative aspect. So after we drill, we have to put a bonding agent on the preparation. We use the best stuff we can find. So we use this G Primo bond. Okay. So you put a little bit on here, and then you put it inside of the filling space. So, go ahead. So basically when you drill into a tooth, the middle layer of a tooth is called dentin. And dentin has these little tiny microscopic holes in it where water can go in and out of it. It also is a way for nerves to get a sensation of what the tooth's going through before it gets to the pulp. So what bond does is it basically goes in to those little holes and makes it so that the actual composite material, this stuff right here, and again we try to use the best stuff we can find, that this stuff actually, it's like a glue for this, but the glue goes in those little microscopic holes and it makes it a chemical bond. So it's not just mechanically bonded like in the old days they used to do with amalgam. The shape of the preparation was basically larger at the base of the preparation than at the mouth of the preparation. And what that meant was that the amalgam, the metal itself, would necessarily just be in the tooth, physically holding in place based on the preparation. So it would harden in kind of like where the base was thicker than the entrance. And over the years, people have stopped using amalgam because you have to take away a lot of tooth structure in order to do it. And what I've found is long term, there's a lot of circumstances where people have had amalgam in their teeth for a long time. And what that's led to is whenever there's repeated forces on that metal, it'll actually crack the tooth in half. And so I like to put composite in because it looks really nice, and frankly speaking, you take away less tooth structure in order to do the same thing because it's chemically bonded. Yeah, so it'll hold the walls together by virtue of the chemical bond. So you can actually use it to teeth that are like really broken down. You can actually use it to hold the tooth together. For root canals and stuff, you can use, if the composite's good enough, you can use it as core buildup material. That allows the tooth to kind of have bulk and structure. So in this circumstance, I know that Jade was struggling with some sensitivity and sharp pain. So I've gone in here and basically in the area that she was having sensitivity, I took away the old filling and I put in a new one. And with the hopes of getting rid of any sort of gaps that might have happened in the filling and the tooth. And also, I'm going to put some desensitizing agent, Gluma, which Caprio is going to go get, in order to make sure that we're setting her up for success here. She does work at the office, so I do not want her, my team, to be suffering for dental issues. They can take care of us. So the last part of the process is bite paper.
Oh, hold on.
And so, Jade, can you bite together for me? So the way that we bite together, each of our teeth has a way of kind of sitting into the ones that is biting up against. And so it's very important for a dentist to realize that the way that a mouth functions, we need to kind of maintain that function when we're doing restorations. The way that we bite together, each of our teeth has a way of kind of sitting into the ones that is biting up against. And so it's very important for a dentist to realize that the way that a mouth functions, we need to kind of maintain that function when we're doing restorations. Oh, sorry.
You're good.
So what I'm going to do here is I'm going to use this bite paper. So tap, 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 Jade, and grind for me. And tap, tap, tap again, and open big. And so this bite paper will actually leave marks on the tooth. As you can see here, you see these marks here? These blue marks. But basically, the blue marks will tell you wherever the adjacent tooth is biting hard against this tooth. And sometimes they turn out to be bullseyes. And bullseyes in general are where it's biting the hardest. So what I always try to do is I have bite paper and anything that's on the actual filling, any blue marks that are on the filling, bite, and grind, I try to take those down so that the patient can feel as normal as possible with the added material in their mouth, so that nothing sinks in. Last step is going to be Gluma. So Gluma, which is this material right here, is a desensitizing agent. And what you can do is you basically, I always like to bend my brushes, but you basically put a little bit of Gluma on a little brush, and the idea behind it is to seal off any discrepancies and to actually create a layer between the tooth and the air. So you put it on. Most of the time I don't put it on like this because it's not usually something that you'll put all over a tooth, but because Jade here has been having sensitivity and I didn't see a huge cavity or anything, I just want to make sure that us doing this procedure actually does lead to a better comfort for her. So you have to light cure it. The blue light cures material. The reason that they did that is because obviously you want to have the ability to manipulate material before it sets on you. It chemically changes the structure of the material as well to harden it. Our materials are 20 seconds of direct blue light and it'll harden. So it all depends on the material. Some materials are self-cure, some materials are light cure, so there's some timing aspects to it which are important. So in situations like this where patients have come in with something that's kind of abnormal, where it's not like a big crack or something or a big filling, I want to put them on watch, and I want to make sure that every week or so that they're actually coming in or at least calling the office and seeing. Yeah, so now I'm going to be like, Jade, if it feels better, you let me know. If it feels worse, you let me know. We'll go from there.
And we follow up.
All right, you're all set for today.
How do you feel?
Good.
Good. Much better now that we're done.
Yeah.